What I'm going to talk about a little bit is the model we're using for planning and how we've sort of moved things along so far. This is all blah, 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 blah. You can read this for yourselves. And you've heard it all. We went through, if you remember, we went through the motions before, so I won't reiterate that. And we'll get on to where we're at. So we are behind, but I think we are going to meet the deadline. So the first major deadline is the end of this month, the end of May, where we have to, the leadership committee, which I'll talk about in a minute, has to submit to the individual boards of Rouge Valley and the Scarborough Hospital a planning framework. And this is really the document that says, how are we going to do the planning and community engagement in the next 4 months once we've submitted this. And hopefully we will have that. It'll have a rationale for why we're going down this path, some common view on terms of where we'd like to get to in terms of a very sort of 60,000 foot perception of where we'd like to get to, and then the process that we'll use for doing the detailed planning. So the leadership committee, which is this box in the middle, is accountable to, is reports to both of the hospital boards as well as to the LHIN board, and we have to submit the work products to the individual boards and then the LHIN board. The leadership committee is comprised of equal numbers of representatives from the Scarborough Hospital and from Rouge Valley. So Rouge Valley has 3 board members represented by Joan Weidman, the chair of the board, the vice chair of the board, and the past chair of the board, along with myself, Dr. Mohan, as you know, is the chief of staff, and Dr. Huang and Dr. Jordan Cheskis, who are the president and vice president of the Medical Staff Society. We also have a member from the community, actually a lady by the name of Israt Ahmed, who is part of our community advisory group. And Israt is a Scarborough resident and a social activist and social planner in Scarborough, and is very well connected in the community. On the Scarborough Hospital side, they have the chair of their board, their vice chair, and another board member, their new CEO, Rob Byron, their chief of staff, Tom Chan, their 2 VPs of the Medical Staff Society, and a community rep who is the chair of their Community Advisory Committee, Paul Rook. And also sitting on the leadership committee is Deborah Hammonds, the chair of, the CEO of the Central East LHIN. The terms of reference for the leadership committee have been set. Dave, correct me, they have been published or are about to be published in the next couple of days, so they'll be publicly available. And they're sort of fairly high level, they're clear in terms of what's expected of us. They'll be publicly available in the next couple of days. Underneath the leadership committee, there's going to be a number of different planning groups and support groups that will really start to get busy post May 31st, quite frankly, because once we've sort of decided how we're actually going to do the planning, we've actually got to start pulling all the information together. So down the left-hand side, there will be, there's the 2 panels that are dealing with the other motions that the LHIN passed. So motion 1A, which was the independent review of the Scarborough Hospital's plans to consolidate surgical and maternal child services between the 2 Scarborough Hospital campuses. That's a blue ribbon panel. The membership has been announced. I frankly don't remember who's on it, but it's a bunch of independent experts. They are going to sit for a whole day as a panel, receive deputations from anybody who wants to make a deputation, and then they're going to come up with an opinion as to whether the plan that the Scarborough Hospital had was feasible. Not whether it's a good plan, not whether it's a plan that should be implemented, but whether it was a plan that was feasible and what are the risks of it. That panel is meeting on May the 31st, and I can't remember where it's meeting. I think it's at the Scarborough Hospital. Dave?
Civic Center.
Civic Center, Scarborough Civic Center, sorry. So we will be in attendance at that, at least listening in the audience to see what that is. The second group is the Maternal Child Panel. This is the one that's looking to implement the clinical services plan as outlined in 2009 clinical services plan from the LHIN. And we're just in the process of getting that terms of reference set up. It really is a mirror, a reflection of the leadership terms of reference. We're trying to do all the terms of reference for all these subcommittees to look exactly like the leadership committee in terms of framework. Just the specifics of the output would be slightly different. And then over on the left-hand side, we've got the various operations and support things that we're going to need. So decision support, health, human resources, communication and community engagement, which will be a big issue sort of post-June as we get into the detailed planning, and facilities and infrastructure, which we know potentially is a big issue as well because of the relative age and neglect that's been applied to the three major campuses in Scarborough. So that'll be a big issue. So that's the planning committee. The leadership committee has met once already. We're meeting again tonight. And then we've got one more meeting before we have to submit the planning framework. We have engaged facilitators to help us work through the process. That's Georgina Black and Janet Davidson from KPMG. Janet Davidson is actually the former chief executive of Trillium Health Center. So if you remember, Trillium and Credit Valley merged about, I guess it's about 2 years ago now, or started a merger process about 2 years ago. And that's what they did. Just to be clear, no decisions have been taken whatsoever as to whether Rouge Valley and Scarborough Hospital are merging. So that has not been decided. It is a question that will be addressed, but it has not been decided yet. And unlikely to be decided probably before we get into the June-July period. So I think that's kind of the overview of where we are at. The rest of this deck is sort of more detail on what each of the things groups are responsible for. You can read it kind of at your own leisure. This is the full membership of who's who from where for the ILC. That's the 1B stuff, which we're in the process of dealing with. Community and group, and that's basically where we're at so far.
In the last meeting, the last town hall, I asked the question, do you know what integrated means? And at that point you didn't. Are you any clearer on what the integration of services mean?
The integration of services at the front line, back office, leadership and governance. What does that actually mean? I think it means we need to develop a much more effective and coordinated system of care delivery within the Scarborough cluster. And do we need to be doing all of the things that we do in each of the buildings that we have within the Scarborough cluster? Is there a better way of organizing how and where we deliver our clinical services and back office functions and potentially leadership and governance? I think that's what it means.
So that would be a departure from 24/7 full community hospital then, if we were going to
No, I don't. Why are you jumping to that conclusion?
Well, from what you had said, you suggested that we don't need to be all doing the same thing at all three, or at all four sites.
We don't do all of the same things at Scarborough Centenary and Ajax Pickering, yet we have 2 full-service community hospitals. It's about, I think, leveraging specialization. So just to be clear, I personally do not believe that closure of an emergency room is on the cards. And if you've got a 24/7, 365 emergency room, that requires a certain set of core services to support its 24/7, 365 operation. And those have been defined in our strategic plan. If you look in the, I think it's the second column over, about halfway down, we define a set of core services that have to be in place to support an emergency room. I would anticipate that is the case. Hi.
So Rick, it's becoming increasingly evident that we're going to need collaboration if we want to succeed. How can we be collaborative if our corporate culture does not promote open and honest communication and instead relies on manipulation and threats? And it requires tremendous courage to speak up against it. And I'm one of those people. I believe there are many others in the room, but they'd be too afraid to speak up. And so I'm just throwing that to you because I believe we need to work on our corporate culture and change the environment. We need to work more collaboratively together and not achieve individual objectives, but objectives for our group, for departments, for individual areas we work, and as an organization.
I agree. Anybody afraid to speak up?
Not really, and we agree that we're already doing that. So we agree that we ethically work with our groups, with our peers, and with our organization for the best outcomes for ourselves, our patients, and our families, and the community.
Rick, one question that keeps coming around, and maybe people are thinking it, I don't know, is one of expectations. People expect this process will have, or some people expect this process would have a set of results very soon, and that's not a realistic expectation, I don't think, and I wanted you to speak to that.
Actually, that's a really interesting point. I mean, there are already people saying that we're trying to do too much too quickly already. And frankly, I don't think we've even got started yet. And you know, we've got a deadline of May the 31st for this planning framework. We've got a deadline of the end of September for the integration plan. I think we've got a huge amount of work that's got to be done in a very, very short period of time. So, you know, I think the next few months for most of the management and leadership, and that, when I say management and leadership, that's physician and administrative management and leadership. I think we're going to be really, really busy on this stuff for the summer. So I think there's going to be a lot going on. And we're going to have to get a lot accomplished in a very, very short period of time. So I think the pace is just going to accelerate. We're kind of getting up to speed, I guess, is where we're at. Any questions in Ajax? Any questions in Ajax?
It sounds like a lot of the changes is around planning at the moment. When would you anticipate there would be changes that would actually be affecting the provision of service? And what would be the 3 possible changes you might foresee?
Okay, so the statement question was, a lot of the work seems to be around planning at the moment, and the answer to that is yes, it is all around planning. The second question is, when could we perhaps anticipate actually seeing some real service changes? And then the third part of the question was, and what do I think the 3 most likely changes are going to be? So in terms of when real change is likely to happen, like if we were to, you know, if we were going to look at some form of service consolidation, when would we look at moving things or consolidating things? I don't think we'll see any of that, quite honestly, before, you know, I'm going to say December, really, really optimistically. I think more likely it would be well into the new year. I think these processes take a lot of time and a lot of planning to make them happen and make them happen properly. So even having the plan, you know, a high-level plan established and approved by the LHIN Board by the end of October, I think getting beyond that and actually making the rubber hit the road, I think we'd be really lucky if we could get anything started before December. And realistically, I think it's well into the new year. What are the top? So that the last part of the question is the good one. What are the top 3 things that I think might happen? I actually haven't got a clue at the moment as to what the top opportunities are. We haven't really seen. We haven't really done any of the sharing of data yet. What we have done is created a huge inventory of things that we think we ought to know about each other. We've called it a due diligence checklist. That's what it is, because you have to go through a process of due diligence once you get into these things. So we really don't know what we don't know. There's a lot of stuff we do know at a very high level about each other. So, you know, we know with the regional cardiac program, they know that they've got a sort of world-class nephrology program. They do vascular surgery, we don't. They're big in orthopedics, we're relatively big in orthopedics. We both have big internal medicine programs. You know, you've seen all the stuff about maternal child and what's going on there, and the LHIN process of 2009, which said we've got to create a center of excellence for advanced pediatrics. So if I was to bet on anything, I think the first thing we actually might start to see gel would be the maternal child pediatric stuff, simply because we've actually been thinking and talking about it as 2 organizations since 2009. And I would hope that we can come to some conclusion on that stuff relatively expeditiously. 4.5 years. That's pretty rapid change for this industry. But you know, I think that would be my guess of where the first place we would see some rubber hitting the road.
I'm just wondering, has anybody reached out to Trillium Partners to ask them about their experiences with the transfer into a partnership?
Yep. So the answer to that is yes, at a number of levels, and we do have the benefit of having the facilitators who are working with us. One of them is the former CEO of Trillium Health Center and was instrumental in the whole merger process, so knows all of the details that went on to that. And interestingly, I mean, I think we found from Trillium that, first of all, it was a little different because it was absolutely voluntary. There was no facilitated integration, so they did this all on their own without being asked to do it. They started at the top, so they started at the board and governance level, and then dealt with management, then started to work on back office, and only now, after 2.5 years, are they starting to look at more detailed clinical integration. Now, having said that, they had already had a process for many years where they'd shared programs. So, or one hospital had specialized in one thing versus another. So, I'll get it wrong, but Credit Valley, I think, focused on cancer. Trillium focused on cardiac. There was another big program in there they'd each got 2 big sort of regional programs, and now they're sort of starting to look at the more bread and butter type programs and how they might integrate those across their 3 facilities. So yes, we're in contact and we've got a pipeline into that.
Will palliative care be on the...
My guess is, Pauline, that at some point everything is going to be looked at. Whether that means everything will change, I would suggest no, it won't, because probably not everything needs to change. So I think we have to look at the various opportunities. So yeah, everything's going to be looked at. Whether palliative care will be one of those things that changes, I can't answer that. Don't have the information on which to answer. Cindy.
Just an FYI on the Trillium and amalgamation. It's not a full amalgamation. The unions are not amalgamated, so the staff have not amalgamated together. The unions are still separate, so the two different locals from each site still remain holding their employees and their membership. So it's not fully completed amalgamation there. So I'm not sure if that's to come. According to the two presidents of QP at that site, it's not going to happen, but...
That's right.
Yeah.
I mean, that's one of the complexities, you know, we're going to have. Well, it's a reality that we have. I mean, we as an organization have five collective bargaining agreements, I think. I think Scarborough has the same. And while they're the same unions, they're obviously different bargaining groups, and bringing those together is a very complex administrative process, which doesn't have a lot of, quite frankly, detailed guidance and support from legislation. So to hear that it's not been done yet at Trillium is not particularly surprising to me. In fact, it's a little easier over there because the majority of their workforce, if I recall, is actually not unionized. It's primarily non-union workforce between the two sites. But yes, that's definitely a will be one of the many challenges that we have to face. Phoebe, do you have a question?
Well, I just want to know really in terms of the community for the whole of Scarborough, also Ajax, in terms of letting people out there know, how is it being sent out to them and how are they reacting to it?
So one of the things that we've done as an organization is link in with our community leaders as much as possible. So certainly, as you know, in the past, the Ajax Town Council, the City of Pickering Council, the region of Durham, and the MPPs have all been very interested in what's going on at Ajax, and we've made sure that we've kept them very much informed of what is happening. In the terms of reference, as you will see when it's published, I think it's going to be published tomorrow, the terms of reference actually specifically excludes patient services at the Ajax Pickering campus. So we're not talking about rationalizing how we deliver services out of Ajax into Scarborough. Ajax is a little bit of an island unto its own through this process, and we've clearly articulated that in the terms of reference. We've made that known to all of our community partners, so obviously that diffuses any angst that they may have. I'm meeting regularly with the MPPs, and I have actually been meeting with the MPPs that have been somewhat angry with the Scarborough Hospital, just to try and understand their perspective and their issues. And you know, it's fascinating to listen to them, because a lot of their issues and challenges are ones that we as an organization have had in the past. When you go back to what we dealt with Ajax Pickering and the issues that Ajax Pickering had with Rouge Valley back in 2005, 2006, there's a lot of similarities between the two. So, you know, we're talking to the Scarborough Hospital in terms of some of the things that we did that started to change those dynamics, both with the community and the medical staff. So I think that's important. So we've been very much continuing to engage with our political leaders. We've met with the Scarborough Town Council. We've met with them in group session. I've met with some of them on a one-on-one basis to talk to them. We're also with the Scarborough MPPs, etc. And we will continue to do that. I mean, that whole concept of community engagement and just letting people know, well, first of all, going and listening to what their concerns are and why they're concerned and what's driving those concerns, and then trying to respond to that is really important. But also being proactive in terms of telling people where we're at and what we know and what we don't know. It's kind of like what we're doing today, right? So I think that's important, and we will continue to do that. Any more questions over at Ajax? Any more questions here? Yes.
With the merger, will there only be one CEO?
So first of all, nobody's decided whether there's going to be a merger, and I don't get to choose how many CEOs they have. That's a board decision. So we'll cross that bridge when we get to it. Okay. Any other questions? Okay, we will be back together, I'm going to say in the next 2 or 3 weeks, to try and give you an update on where we're at. And if anything new or exciting breaks in a big way, we'll be back to you faster. Thank you all.